So, Shirley's asked me just to talk a wee bit about NIV and the relevance it has in an emergency setting. So I think the first thing to establish is that NIV is essentially BiPAP, or bi-level positive airway pressure. So it's used typically in type 2 respiratory failure. So I think first of all it's important to establish or to be able to flag up when you've got a patient with this kind of situation. So you might look at a gas and you might spot, for example, that their pH might be considerably low along with a very high PaCO2. And so typically when you've got these two scenarios combined, it typically results in type 2 respiratory failure, typically with a patient that might come in with an acute exacerbation, for example, of COPD. So once you've established that, then you kind of know you're heading down the NIV route, and obviously this will be in discussion with one of the senior doctors. But essentially what will happen is that it works as a form of ventilation, so that you're essentially ensuring that you get significant positive pressure during inspiration, which is greater than that during expiration. And the whole point is that you want the airway or the alveoli to remain open for as long as possible. So typically what might happen is when you expire, your alveoli are going to essentially collapse. But with BiPAP, it's going to ensure that they stay open for longer, so that we ultimately clear that CO2, and ultimately then you're in a better position to stabilize the patient and make them more comfortable, and eventually after perhaps 24 hours or so you might trial them off the NIV. Now this is in contrast to something like CPAP, which is more common in type 1 respiratory failure or acute situations such as pulmonary edema, or during COVID, perhaps hypoxia as a result of chest trauma. And this works in such a way that you're basically splinting the airway open, so you're giving constant positive pressure. And again, the ultimate aim is that you're keeping those alveoli open, so that you're, I suppose, enhancing or just facilitating that exchange of gases such that they can oxygenate and better ventilate themselves. Okay?